repalpate the tip of the coccyx and work our way up or down. You can start at the tip and work your way up, or you can start up and work your way down the side of the coccyx to see if there are any tender points. Are there any tender points, Barbara?
No.
Okay, I'll use my index finger on the opposite side and press on the right-hand side. And if there are no tender points, then the move is made from lateral, from left to right. If there is a tender point on the right side, then the move has gone from the right side to the left side. Again, we're going to tuck the chin to the shoulder. I'm going to repalpate the tip of the coccyx with my thumb and move up just a finger. I'm going to take my first finger, index finger, and press it on that sacral notch. And I'm going to move the leg externally rotated until the right hip becomes engaged and starts to lift off the table. I'm going to bring the slack with my thumb lateral or toward me, and then I'm going to make a move toward the right side over the coccyx. And slowly put the foot back down. We're going to leave the room and wait 2 minutes. Coccyx move we never do on a pregnant lady. Okay. After 2 minutes, we turn the client over on to the supine position. Go ahead and turn over my. And move down toward the foot so your head's not in the hole. And once the client is on their position, we abduct the leg slightly. This is called the coccyx lock. This is the first thing you do after you turn the client over. If you did the coccyx move, we're going to flex the knee, and I'm going to take my 3 fingers of my right hand. I'm going to place them between the umbilicus or the belly button and the front of the pelvis bone, right in the middle. I'm going to take the slack toward the inguinal ligament. As I flex the knee, I'm going to make a C-shaped curved move toward the belly button. And as I bring the knee over, my hands change directions. Now my fingers are coming outward across the rectus abdominis muscles. So my hand has started with my fingernails pointing toward the inguinal ligament. Make the move in toward the umbilicus. My hands turned around now 180 degrees, and my fingernails are facing her rib cage as I complete the move by moving the knee toward the left shoulder. I'm going to lift the leg straight up and bring it back to the center position. And that completes the coccyx lock. You can do the coccyx lock on infants who have colic. You can also do the coccyx lock on people who have irritable bowel syndrome. Or it also helps with chronic diarrhea. After the coccyx lock, the next thing we're going to do is we're going to finish respiratory, aka asthma, part B. The middle finger goes just below the xiphoid process under the sternum. I use my middle finger under the rib cage, and I start about mid line toward just below the nipple. I bring the slack up toward my hold finger. This is a reflex point finger. After I take the slack toward it, then I make an inferior move back along the infracostal margin toward the hip. I'm going to stay on the same side. Use my thumb on the opposite side. And I'm going to take the slack toward my middle finger in the hold point, and then I'm going to make an inferior move on the infracostal margin. And I release the pressure with my middle finger, replace it about 1 inch below the hold point to make move 3. Move 3, the slack goes back up toward the reflex point that I was previously holding, and the slack goes superiorly and the move goes inferiorly. Sometimes we'll make 2 moves. After the respiratory procedure has been finished, we do I start the knee procedure, because the knee procedure, the first move of the knee procedure is to hit the lats. Hitting the lats is very important. So I want to find the superior margin of the patella or the kneecap, and there's a little hole. And when I find that little hole, I'm going to put my thumb in it, and I'm going to drop down toward the tabletop. And I'm going to take my other thumb and I'm going to put it alongside. And I'm going to very, 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 very slowly start raising my thumbs up and raising my wrists at the same time until that little muscle tendon pops out from underneath my thumbs. That's called hitting the lats. If you're not going to do the knee procedure, then after you hit the lats, you can start basic relaxation procedure number 3. But for this demonstration, I'll go ahead and do the knee moves. This is part A of the knee. They would call it the eyes of the elephant. You come up the shin with your fingers and slide up until you come up to the bottom of the patella. You'll find 2 little holes. First move is with the left index finger, and the slack comes inferior, and the move is superior. The second move, actually the third move, is the thumb. The slack is pulled inferior, and the move is made superior, angling out toward the left hand. If there's a problem with the knee, you wait 2 minutes before doing move number 4. If there is not a problem with the knee, then we will go ahead and complete move 4. Put the hand flat on the patella where your index finger lands. Take your opposite right index finger, place it adjacent to your left index finger, slack toward the tabletop on the inner side of the thigh, and make a medial or lateral move up over the inside of the quadriceps muscle. And we do the left side first, unless it's injured. Now we're going to do the right side, same procedure. We're going to take the slack toward the tabletop over the vastus lateralis. Slowly, slowly, slowly raise my wrists, increasing the pressure as I go, as that little vastus lateralis muscle pops out from underneath my thumbs. I slide up the shin to the eye of the elephant, slack inferior, move superior. My index finger, slack inferior, move superior with my thumb. Hand flat on the patella, index fingers come together, slack toward the tabletop, move dorsally. That completes part A of the knee. Now we're going to start part A of the basic relaxation move, procedure 3, which is the neck. I'm going to use, there's 2 ways you can do these moves. One is by grasping your index and middle fingers with your right hand, of your left hand with your right hand, placing them on the side of the neck, and make a gradual little rake across the neck muscles by moving your whole arm structure from side to side. And after we complete the first move, we place the fingers of the right hand into the grasp of the palm of your left hand, and place your thumb against the side of the neck. Skin slack goes toward the posterior aspect of the neck, and then the move is made from lateral to medial. I prefer to use my left hand, the thumb of my left hand, and place it on the side of the neck. In front of the sternocleidomastoid, this move is done over the anterior scalene muscle. It's just to the side of the Adam's apple. I take the slack posteriorly, and I make the medial move. I use my right thumb for the right side, and I pull the slack toward the table, and I make the move lateral, or anterior. The second, or the third and fourth moves of this procedure, I use the middle fingers of the left hands, of both hands, left side first, and right below the occipital ridge, there's a little indentation, and right in that indentation is about a finger in and a finger below the ridge. I take the slack lateral with my middle finger, and hold for 1, 2, 3, and then make a medial move. I take my right hand, my right middle finger, slack toward the lateral. 1, 2, 3, and the move is medial. And there's a minimum 2-minute wait between procedures. Moves 1, 2, 3, 4, which is part A. I'm doing part B. That muscle that I just moved was the trapezius muscle, just below its insertion. If we wait 2 minutes and come back, and we can do the trapezius again in the middle of the neck. And here I'm joining my 2 middle fingers behind